He goes to me, I swear, and he said, I don't give a flying F about this patient's diabetes. Are we operating on his knee or are we not operating on his knee?
Hey, everybody, MedPro Dojo family. This is Natasha, and Joe Radich is with us today. He is the founder and clinical director of R3 Health and Med House. I'm super excited to have him here because he was in my office, gosh, it must have been 5 or 6 years ago, to train our providers in the office on all things regenerative medicine. We did P shots and O shots and hair restoration and facial stuff and joints. And we had an incredible time. So I couldn't think of a better guest to join us for our upcoming webinar that's coming August 5th. And we'll talk a little bit more about that. But I want to thank Joe for being here. And I want to introduce you guys to him and our community so people can really understand, Joe, who you are, what you do, your area expertise. So I'm going to ask a few questions as we go along. And then towards the end, I'll talk a little bit more about the webinar you're going to be hosting with us on August 5th. So without further ado, people may not know you. So tell us your story. How did you get started in the functional and regenerative medicine side? And what led you to R3 Health?
Yeah, for sure. Well, first and foremost, we look 10 years younger, don't we?
Well, my hair's gray since the last time you saw me.
Yeah, thank you so much for having me on. So my story, man, it's kind of a good one, I think. So my traditional training as a PA is actually in orthopedics. So I come from traditional orthopedics, mostly in operations setting. I was a first assist in a pretty prominent orthopedic clinic and group in New York for many years. But I really just kind of got sick and tired of the traditional medical rat race, which I'm sure many of us know, felt, have experienced. So I like to tell this story. It's a quick story just because it kind of cements the point of why I moved into functional medicine. So I was working for a very busy orthopedic institution in New York. And I was in the surgical cases. So I was kind of doing pre-surgical clearances, operating, etc. Long story short, I go in to do a consultation on a patient who was coming in for a knee evaluation for potential knee replacement. I go in, I do my consult. I learn that this patient is really unwell, really sick, uncontrolled diabetes, morbidly obese, elevated triglycerides and cholesterol, yada, yada, yada. So I go out from doing this history and physical, and my attending at the time, he asked me, okay, he goes, Joe, are we going to operate on this guy's knee? Are we going to do a total or partial knee replacement? And I said, honestly, I don't think he's a good candidate. I think he's really unwell. I think he's really sick. I think he's going to have a lot of issues, and I think it's just going to have bad outcomes for us. He goes to me, I swear, and I'm not going to curse, but he cursed, and he said, I don't give a flying F about this patient's diabetes. Are we operating on his knee or are we not operating on his knee? He said that to me, and I didn't know how to react right away. I was a new PA, maybe like a year in. So, you don't question the orthopedic surgeon, right? I said, I'm going to leave it up to you just because I don't feel comfortable and confident to decide on this person's case or not. And so long story short, we did the operation. Fast forward 2 days later, complication number 1, infection. Fast forward 2 months later, we're at complication 4 or 5. Patient had so many complications. Long story short, I found out about 8 or 9 months after the surgery, the patient ended up passing away. And that's not to say the patient passed away from the surgery, but multiple complications really made that patient that much sicker and probably led to ultimately his demise. So it was that day that I found out that patient passed away that I started immediately looking into functional medicine residencies because I could not do traditional medicine anymore. And so I really literally moved from traditional orthopedics and did a residency program with a functional medicine training organization. This was 15 years ago. And I've been doing functional and integrative and regenerative medicine ever since. So I like telling that story because it just, so many of us struggle with the traditional medical model and just being in this very difficult position ethically and just, administratively. And I just got sick and tired and fed up with it. And so I kind of transitioned myself into functional and regenerative medicine. I've been doing it for about 15 years.
Yeah. And in that 15 years, what have you seen changed since you first started? And what excites you the most about where it's heading?
Yeah, so much has changed in 15 years. It's really crazy. You pull up Instagram or TikTok or whatever social media platform right now, and all you're hearing about is peptides and microdosing GLP-1s, right? Like literally wherever you go and you look, it's there. So, it's crazy because if I really sit back and reflect, I was using BPC 157 15 years ago. You wouldn't know it. We didn't quite know, or, it wasn't out there, but some of this is not new. It's just the attention, the awareness, the accessibility is now new, right? There's been so many advances through peptides and, the theories around hormone replacement and hormone optimizing, and IV therapies have really emerged, and biologics, stem cell, same thing. After leaving orthopedics, I moved into a stem cell clinic 15 plus years ago. So this is not new. This is just the awareness is growing. So there's been so much in the advancements of functional and integrative medicine. It's hard to pin one answer to that question. Just everything about our industry is just exponentially booming. And now is still a time to get in, right? This is not a fad. This is not anything that's going away. It's just going to continuously, exponentially keep growing.
Yeah, I love that. And that's probably why you said you look so much younger. My hair's just turned gray, but I do feel like I'm much younger from the inside from the regenerative therapies I've had as well. I've done stem cell through IV, through my joints and other peptides and things like that. So yes, it is all the buzz and all the hot topics. What do you see as a practice built around optimization? Like you said, hormones, longevity, regenerative therapies. Talk about that, because we always say vanity knows no recession, but we're talking about vanity that comes from the health on the inside versus what we're doing to the outside. So talk a little bit about that.
Yeah. So I think patients nowadays are more than ever not accepting no as an answer, right? Mm-hmm. They know that there's something wrong. They know that they can feel better. They know that they can achieve better. They know that their PCP who gave them 3 minutes of FaceTime is not educated on what they should be doing proactively. So patients come into this equation smarter than ever, and they're seeking this stuff. People are looking for this information. So why shouldn't it be you, the one who's in front of them, to give it to them, right? So, we started what we're going to talk about, this training platform and these training events, with the understanding that practitioners are wanting to be in this field. They want to incorporate these treatment modalities into their patients' programming. This concept of really health optimization and anti-aging medicine is now legitimately a thing. This is not a fad. This is not anything that's going away. It's going to continue to evolve and continue to grow. So, you kind of have to get into this field in order to keep pace with what your patients are asking you about and what your patients are wanting. So it's kind of an evolution out of necessity if you want to be relevant or continue to be relevant in your medical practice.
Well, and talk about relevancy, it's crazy. You can open Instagram and that's all you're getting hit with is peptides. And so it's almost like social media is educating people on what they want. They're creating consumers. So like you said, the practitioner needs to catch up to the time. So many practitioners are interested in adding regenerative and functional medicine services, but they aren't sure where really to begin. What do you think the biggest misconceptions are in keeping providers from getting started?
Yeah. So going back to just what we were talking about with social media platforms, what a social media platform is not is an authoritative presence to tell you how and what to do it, right? I always laugh because patients will come in and saying, yeah, I saw this on TikTok, or I saw this influencer talking about this on Instagram, or, Kim Kardashian's talking about this, or Kylie Jenner's doing that, right? So great, it brings awareness and attention to what we're doing, but please don't take your peptide dosing advice from a social media influencer. So, I think ultimately it boils down to, again, we got sick of hearing patients say, I saw this there, I saw this there, what do I need to be doing, right? And so, our functional and integrative medicine training events and training platform are going to really kind of set the record straight, right? We want to make an accessibility and platform available for everyone to have a general consensus that's rooted in evidence, right? Everything that we're going to talk about is evidence-based and evidence-backed, right? So we don't want to just say, hey, you should be dosing 20 units of BPC 157 5 days a week, right? We want to understand, what's the application, what's the methodology, what are some of the other co-variables that patient is then being influenced by, and hey, that's how we can come up with a dosing protocol for that individualized patient, right? So, we felt that there was really nothing out there that did a really effective job at really giving the evidence-backed data on a lot of these functional and regenerative medicine modalities. And that's really what prompted us to kind of start from the ground, up and just really build something that we're really confident and something that's really not available yet. And so we're excited to launch an e-commerce platform as well as a live event platform.
That's awesome. We're super, super excited to have you and being able to help our community and being able to feel confidence, have the evidence that backs it, and then be able to provide exceptional care for their patients to get amazing results. Now, I know you've trained hundreds of practitioners, and the office I was at being part of that. What really separates providers out who successfully integrate these services to those who are staying on the fence and not really doing anything about it?
Yeah, so I think the key is just committing to the education first, right? Like we were talking about earlier, you have to kind of fully immerse yourself in it, right? So getting an understanding at the biological and cellular level and the pathophysiology, I think, is super critical, because then you really are becoming a grand master, and then you can really educate your patients more effectively and communicate more effectively so that they're understanding what you're saying. And it really kind of gives that mutual relationship between you and that patient. So I think really just a good functional medicine office is one that's rooted in education, and they help their patients understand their health and understand why you're recommending certain things, and really putting together the best roadmap for them. So I think people that are successful are going to jump in. They're not going to try to half-ass anything or try to piecemeal things. I think they're going to not cut corners. I think really investing in your education and your understanding of all these great tools, I think, is really someone who's going to stand out versus the, IV clinic, the IV hydration clinic that's on every single corner, right? Finding strategies to help yourself differentiate yourself from all of these other functional medicine companies and organizations that are out there is what's going to really differentiate you and help you be the most successful.
Yeah, that's awesome. One of the things too is we hear the definition of functional medicine sometimes be so different. So tell me, what is your definition of functional medicine?
It's a good point, and you're right. There's so many different ways to look at the word functional medicine and kind of try to define it, but we really look at it as the definition being a patient-centric, kind of root cause analysis and individualized planning, right? That really boils down to what functional medicine is. It's patient-centric, right? Giving the patient the autonomy to kind of make their own healthcare decisions. So giving them the education. It's root cause analysis, right? So, hey, why am I feeling tired? Why am I gaining weight? Why can't I get weight off? Why am I not sleeping? And then it's really about individualized treatment programming, right? Nothing that we do in functional medicine should be cookie cutter. Mm-hmm. Everything needs to be individualized. So functional medicine is that. It's medicine that improves the functional quality of life of our patients. That's, I think, the simplest way to look at it.
That's great. And tell me some of the modalities, like as you're looking at blood work, and what are some of the diagnostics that you do? And then what modalities do you do to help that person heal from a functional side?
Yeah, so really when we are programming for people, it starts with, an in-depth analysis, right? We need to get to know our patient from both a lifestyle perspective and from a biological perspective. So, we'll run a very comprehensive set of blood work looking at things that are kind of more outside the box, things that we know play a role in a patient's quality of life. So things like hormones and inflammation markers and neurotransmitters and gut testing. We are huge advocates for some of the advanced testing that is now available too. Things like cardiac IQs, things like Clearly scans, things like Pronovo scans, things like advanced gut and metabolite testing. All of those really have its place. And that is what allows us to really put together an individualized treatment plan. Because for a patient who's in a functional medicine regimen, you need to think short, immediate term, but you also need to be thinking about long-term planning, right? Our goal is to make sure that patients are being supported today and that their health is on the best trajectory, not just short-term, but also long-term. And so, it's that type of analysis and relationship and those types of histories that we need to gather in order to make sure that we're ordering the right diagnostics to get the right information in order for us to put the patient on the right trajectory.
Mm-hmm. I love how you said relationships. I think that's something that's so missed, excuse me, in traditional medicine is we're not building relationships. We're not seeking to truly understand, like, what are you doing in your life? What's important to you? So I think that's beautiful. And the tools that you have to be able to help that person achieve true health is something that many are not doing. It's kind of like throwing spaghetti at the wall, if you will.
Yep.
Any other things that you want to talk about that you're seeing in the space that's cutting edge, that's new and up and coming, or that's been around but maybe has just gotten the hype?
Yeah, I mean, I think peptides is the category, again, that's all the craze and buzz right now. But really, there are so many advancements happening every month, and they will continue to happen. I'm really excited about peptides and the future of peptides. Again, I've been using peptides for 15 plus years, so it doesn't shock me to know how effective these things are and how amazing they are when they're done right. But I really look at peptides as an emerging area of our scope of practice. I really look at biologics and stem cells, both on an allogeneic front and an autologous front. So, using patients' own stem cells or, donor cells, things like exosomes. I think as we start to really wrap our heads around that and how best to implement them, as well as some of the advancements that are taking place, I really get excited about stuff like that. And I come from orthopedics, right? So that's naturally kind of more exciting to me. But we're using these tools for autoimmune disease. We're using these tools for chronic inflammatory comorbidities. We're using these tools for health optimization and longevity, right? Not just orthopedics. So I really get excited about those two categories, peptides and biologics.
I love it. Yes, me too. Well, thank you so much for sharing all that. And before I wrap it up, I want to kind of shift for a moment. What should practitioners, or why should practitioners attend the upcoming webinar that you're doing with us on August 5th? What should they expect to learn? And deciphering through all this great information that you just gave us, what are you going to bring to the table on that Wednesday?
Yeah, I'm really excited for the webinars because, again, it's a great little teaser almost to help you understand like the true potential of jumping into this space, right? Mm-hmm. So we usually like to pick a topic, whether it's peptides or IVs or biologics or hormones or whatever, and really just kind of give that kind of first exposure. For people that want to get involved and they're just not sure where to start, you'll get to understand us and what we do and how we communicate and the level of complexity and detail that we're going to bring to the table. So we're really excited just to get in front of new faces, really help people understand this is a field of medicine that's not going anywhere. Mm-hmm. This is a field of medicine that if you've even thought about it once on a weekend, you need to be doing it. This is something that really your patients who are in your office currently are already doing it, seeking it, wanting it, looking for it. So why not let it come from you? So we're really excited because it just helps people get to understand us and some of the things that we can hopefully deliver to you.
Yeah, that's fantastic. Well, we are super excited. We can't wait. So everybody, we are doing this Wednesday, August 5th, 2:15 Pacific time, 5:15 Eastern time. So we'll have all the information for the webinar. We're looking forward to it. Joe, thank you so much for just sharing your heart, sharing what you're doing. I'm super excited about it. So we'll see everybody Wednesday, August 5th, and we'll see you next time.